Of COVID-19 in the national capital, the Delhi High Court has now directed the government to ramp up testing. So amidst the rising cases, the High Court has said that testing in the country's capital city must be significantly increased. The High Court has urged the private hospitals that have 20% reservation of beds for COVID patients to also conduct the tests both on symptomatic and asymptomatic patients. The High Court was hearing a PIL that sought a court direction for testing facilities to be ramped up. And in response to this PIL, the court believes that there should be an increase in the number of testing. The current level of testing is insufficient and inadequate given the numbers and given the threat that the Delhi citizens are facing. The matter has now been listed for further hearing on the 18th of June. So this is clearly a court intervention in the matter of testing. Remember, this entire testing policy of the Delhi government has gone through quite a few twists and turns. Firstly, with the removal of the word asymptomatic, which was, of course, questioned because it's a violation of ICMR guidelines. That was set aside by the LG. Now, the new issue with regards to testing is that the numbers are not sufficient enough, and that is what the Delhi High Court has observed, urging the government to now ramp up its testing. So we are going to look at this entire issue from the perspective of whether testing in the capital city is inadequate given the number of people who are susceptible to COVID-19, given the number of rise, the per day increase in the cases, all of those factors considered. Testing, it seems, has been flagged off as insufficient by the Delhi High Court, which is why the court has said that they should ramp up testing facilities in private hospitals as well. 20% beds reserved for COVID patients in private hospitals, and therefore their in-house labs now must be made equipped for testing so that people who go into these hospitals can in one stop get the testing done and get admitted as well. That seems to be the larger idea here. This was observed during a hearing of a PIL that sought for more testing facilities in Delhi. The current figures, in fact, as per latest reports, have come down. Earlier, Delhi was testing above 5,000 per day. Now the figure has come down, and with the Delhi Health Minister also saying that just now, in fact, Satyendra Jain just a short while ago pointed out that the number of suspects have increased significantly in Delhi, and therefore the government has certain constraints, even though protocols have been put in place to streamline the process of testing. Let's tell you what the Delhi High Court has said. Delhi is fast heading towards becoming the corona capital of the country, an epithet the city can well do without. Most unfortunate that non-COVID patients being made to wait to undergo tests. Need of the hour that private hospitals are equipped with labs. They should be permitted to do testing. So these are the observations made by the Delhi High Court with regards to testing in the capital city.